My name's Chris Roberts. I'm based at the Pilgrim Hospital and I volunteer 2 days a week. On a Tuesday I volunteer in the Bostonian, which is the cancer ward, as a ward volunteer, and on a Wednesday I come into the chemotherapy suite. I've been volunteering for approximately 3 years now. Well, on a Tuesday, as a ward volunteer, I will do whatever I'm asked to do, so all the staff know that I'm there to help out, so it doesn't matter who it is. If they ask me to do something, I'll do things like I'll take bloods down to the path lab, I'll go to the pharmacy and collect medicines, or take prescriptions down. I might do some admin work for the ward clerk. Just in general, anything that they ask me to do, then I will do. My role in the chemo suite is to basically make refreshments. So I make teas and coffees. I also take orders for sandwiches for lunchtime, and give the patients their lunches. And because amongst all of that, I chat to the patients, because having cancer myself, it gives me an idea of how it is for them. It helps them, I think, to know that they're talking to somebody that's got some idea of what they're going through and what it feels like. So between all of this, I just chat away. Because I was diagnosed with cancer 11 years ago, and the trust has looked after the Pilgrim Hospital. Has been amazing, and they've looked after me and cared for me, and treated me all the way through the past 11 years, and are still doing so now. So it's just a way of giving back, really, of saying thank you, and also to be able to have something to do, because I've retired now. And it's something for me to do on a Tuesday and a Wednesday, but it's also something that is very dear to me, that I do something for the trust. It's nice to be able to give back to the hospital, because they've looked after me and they're treating me, even now they treat me for my illness. And it's such a lovely place to be, and a lovely place to work. The people are really nice, and to be able to talk to the patients and reassure them and know where they're coming from, I think doesn't just help them, but I think it's quite good for me too, because I feel as though I'm helping them. So it's just basically, it's a nice place to be, a nice place to work, and it's giving back to the community. Well, because I'm a patient, obviously, I've been in the hospital when a volunteer's come in to ask me if there's anything I wanted or to have a chat. And then what really, I suppose, started it for me was I was having chemotherapy. The last time I had chemotherapy, I was chatting to one of the nurses about it, and she said to me, "Oh, Chris, come and work with us. Come and work with us." And I said, "Oh, really?" And she said, "Yeah, come and volunteer with us." And I just thought, yeah, why not? So as soon as I was able to, after I'd retired, I applied to become a volunteer, but came back to the chemotherapy suite.